Hi everyone, I wanted to come on today to talk a little bit about menopause and depression. So when I'm referring to menopause here, I'm talking about this whole menopause transition, which can start anytime in the early 40s, well up into 55 or beyond. But most women, the average age of menopause is 52. And why do I want to talk about depression? Because of a patient that I've been seeing. So I want to share a little bit of her story first so that you understand. So I saw this patient. She's now 56 years old. She's was feeling well. She works independently, was loving her job. And then several years ago, she began noticing that her mood was just not right. She couldn't focus on tasks, that she was getting very overwhelmed very easily, and she thought that something might be going on. Of course, she was starting to get hot flashes and night sweats, and then she was having a lot of difficulty in sleeping. And her symptoms were really getting very, very bad, to the point that she was thinking that she needed to leave her job, that she was feeling so overwhelmed. She didn't know what was going on within her family. And she was aware that, yes, she was in menopause, but she was beginning to actually blame herself because she was thinking that, what's wrong with me? Why can't I feel better? You know, she knew that she was always a happy person, always in her life. She used to exercise a lot, but she had no energy. She wasn't able to do her fitness like she did before. She started gaining weight, and she said, this is just not me. I just don't feel like myself. So what happened? She actually did go into a state of burnout. She ended up leaving her job or taking some time off on depression. And then she ended up having a lot of physical consequences because she had a fall and had an injury. So then she was immobilized for a while. And during this time, she said, I went to see my family doctor and they offered me antidepressants. And she said, I got the prescription filled, but I really didn't want to take it because I never had depression in my life. And I really didn't feel that this medicine was going to help me. So she said, I struggled on and I got through it. And a few other things had gone on in her life. And then she was coming to see me at the clinic. So she shared her story with me. And my heart went out for her at that time, because I knew that her brain was changing then, and a lot of the overwhelm and anxiety that she had gone through was because of the menopausal changes and the depression that is associated with it. And so we went on in the conversation, and she has now started on HRT because she still has some feelings of anxiety and difficulty with focus. Also, she's still really concerned about her memory. And so we started her on hormone replacement therapy. But I wanted to give that example because she is a high-functioning woman that never had anxiety before and was completely overwhelmed by this and depression. And she called it burnout. But I want us to relabel what burnout may be. And this is the hormone changes that go through as you go through the menopause transition. So what we don't understand, and what people often think, that menopause is just about hot flashes and night sweats. And they think, okay, it's fine, I'll just get over it. But what are some of the things that we know? That menopause is actually a neuroendocrine change in the body. So what does that mean? So neuro is referring to the brain, okay? And endocrine is referring to the hormonal cascade that is going on inside our body. So we know that during menopause, estrogen and progesterone go down. I think most women and people understand that. But what we don't understand is how the change in those hormones actually impacts the function of the brain. So what happens with estrogen? So we know that estrogen modifies and modulates our neurotransmitters. So these kind of chemical messengers that are going on in our body. So in particular, we see serotonin and dopamine. So we often talk about serotonin because it's the feel-good hormone, and dopamine, which is the one that can actually just make us have pleasure and feel good in life. So when estrogen goes down, it highly impacts these areas of the brain. And then we know progesterone hormone is actually also very important, and it modulates anxiety. So more and more of this information is coming to the forefront now, and we have a lot of neuroscientists that are working to show us that these are true changes that are going on in the body. So in April of this year, Dr. Lisa Mosconi released her research paper. Now, she is a neuroscientist based out of New York, and she was able to localize areas within the brain that changed during the menopause transition. So in the early part of menopause, what we begin to see is that the areas of the brain that are infected or that are impacted are the areas that are important for sleep regulation and also for hot flashes. So this is early on. So women, in their 40s, and then their mid 40s, and then a little bit later on, so maybe late 40s or early 50s, we see the areas of the brain that are impacted with these estrogen receptors, the areas for anxiety and for cognition. So cognition is our ability to think clearly, to focus, to be able to concentrate, but also our mood, the way that we feel about ourselves, about our lives, about others that are around us. So menopause is not simply having a sweat on, it's the changes that are going on in the brain. And this is only now being more and more recognized, but I've seen patients time and time again that have come in to see me, or I've seen them in the hospital or at other clinics, and many of them are on an antidepressant, they're on a sleeping pill, often they're on a stomach medication, and sometimes they're even on something for pain within the body, because all of these changes are going on through the menopause transition. And again, there's nothing wrong with being on maybe a medication, but we have to look at what the root source is of this problem. I'm a functional medicine physician, and this means that I look at the body as a system, as a whole, because all systems are connected together, but also I look at the root cause. So when I look at a woman that comes in, especially when she's never had menopause or she's never had depression before, then what I start to see is that what is causing her to have these symptoms? Why is she breaking out crying? Why is she wanting to leave her husband? Why is she wanting to throw things at her children? And it's because of the changes that are going on in her brain, neurochemical changes that are going on. So we are studying this more. Like I said, Dr. Mosconi is beginning to study this. And for those of you that might be out there, again, you can feel free. I'll have some comments in a few minutes. But if you wanted to put anything down below, you could. But we know, so Dr. Mosconi's work, and there's several other neuroscientists that are examining this, but also just released in August of this year from the Australian Medical Journal. The title of the article was Menopause and Depression, Under-Recognized and Poorly Treated. Why is this happening? So it's because this awareness has not yet been communicated to physicians. And so a big reason I wanted to bring this on today is for those of you that may be going through these changes, because instead of reaching for an antidepressant, you may want to consider that hormonal replacement may be an alternate therapy for you to try if you're going through this time period. So what else do we know about menopause and depression? So we know with research that's been done by University of Penn State, Harvard, and also out of Melbourne, that women that go through menopause have anywhere from a 2 to 4 times higher risk of depression. And these are women that have never had depression in their lives. So this is the patient that I had this example this week. She was always a happy, kind person that could focus very clearly. And then as she went through the transition, it turned her into anxiety, depression, and burnout. So this is well documented. This is happening. So we know that it's happening in this transition that women normally go through. So first, the sleep is going to start. And even just by a lack of sleep, we know it's going to start to impact our body and our mood. Have you ever tried going just for a few days with not sleeping? You're going to find that you're a little bit grumpy. You can't concentrate and focus as well. And that's because your body hasn't been able to reset itself at nighttime. So early in the menopause transition or in perimenopause when you're changing, if you're not sleeping well, it's going to begin to impact your mood. And then it's going to go further and further because we know that it goes beyond sleep, that it's having that change on those neuroreceptors in your brain. So these are women that are going through a regular menopause transition. But another group that I really want to bring up is women that go through premature menopause. So what is this? This is going through menopause before the age of 40. And up to 4 in 100 women can go through menopause early or premature menopause. I also see a lot of women going through this when they have had a surgical menopause. So they've had their uterus removed for whatever reason. Maybe it was for pain or for bleeding. But those women also are going to be at a much higher risk than of depression and anxiety disorders because they've had their hormones even earlier than other women that have gone through the regular menopause. So why do we need to talk about this? So number one, if you are considering having a hysterectomy, first I would like to say examine the reasons why you need the hysterectomy. I'm getting several patients and now they're coming for second opinions because they're thinking, I'm only 38 years old or I'm only 42. Is my best thing to get a hysterectomy at this point in time? Or are there other options that might be able to help me? Now, these are women that's not for cancer-based reasons, but they're for other women. So one is, do you need to have a hysterectomy? Consider that. And so then if you did have a hysterectomy, and maybe you're thinking now, Dr. Keenan, I had a hysterectomy when I was 42 and I'm describing all the symptoms that you had, but my doctor told me my ovaries are still there, that I shouldn't have to worry about it. Well, what happens when you have a hysterectomy? Your uterus is gone. So also they typically will take your tubes, your fallopian tubes. And when that happens, a lot of the blood supply to your ovaries is also impacted. And when the blood supply goes down, then the ovaries don't always have the same function that they had before. So women can start to go into signs of early menopause when they have that early hysterectomy, even if their ovaries are there. Okay, so this is an important thing to know. So we've talked about going through menopause. We've talked about why hysterectomy can put you at higher risk then, especially for depression. But then what can we do about it? So most of you would probably know that if you go see your family physician, they're going to want to give you an antidepressant. And we know that those can be possible as treatments for menopause. So May 15th, 2023, the Canadian Medical Association Journal released an article that physicians like me, we read, and it was a pragmatic approach to the menopause. And it says in this article that all physicians should begin to discuss with women in the perimenopause time period, an approach to menopausal treatment. And it also says that the number one way to treat hot flashes and night sweats is estrogen-based or hormonal therapy. So it also goes down to describe that women can use antidepressants to help them to overcome those symptoms at the time. So the first thing you need to do if you're having these symptoms is number one, discuss it with someone, whether it's your family doctor, your nurse practitioner, or maybe your girlfriends. But say that, okay, I'm really feeling these symptoms. So being aware that this could be related to your hormones. And then you need to seek help from perhaps a health professional. And you may want to have the decision, number one, how much is this impacting my quality of life? Because many people will have, I have decisions all the time with patients that what is its impact on your function? What's its impact on your family? Its impact on your work? And many people think, well, I can get by. But other people are telling me, Dr. Keenan, you need to do something because I am going to lose it. Like I cannot function the way that I am right now. So if you're in those different categories, so if you're having mild symptoms, we know that by focusing on rest, we know that by focusing on eating whole foods, eliminating sugar, reducing the amount of alcohol, by getting regular exercise, that can help you with very mild stages of depression and anxiety. But if you are ready to leave your job or your husband, or you've thought that I can't go on anymore like this, then you really need some type of treatment to help you. And I would say for many women, the number one treatment is going to be hormonal replacement therapy with estrogen therapy and progesterone for most women. Antidepressants are also listed there. Like if you look at this article that our physicians were given, it talks about things like Effexor or venlafaxine or a lot of different SSRIs. But one of the things that we know, those drugs are going to work on the brain. They can also have side effects. And one of the things I want to bring up, especially for women, is many of those drugs will further lower libido. And that's already a problem for most women. And when women are trying to maybe have a good relationship with their husband because they're having so much anxiety, we don't want something that's going to further lower the libido. And why I really am an advocate for hormonal replacement therapy for women going through this and intensive depressive symptoms is that you're also going to get the benefit of what estrogen does to all other parts of your body. So you're going to get the benefit to your bones. It's going to take away your hot flashes and your night sweats. It's going to help with your gut. It can help with insulin resistance. It can help with your skin. So those are all the additional benefits that an SSRI is just not going to provide you. So I hope this has been helpful. This is beginning the discussion. You can share the information that you read here. I'm going to post some articles below in the notes that you may want to read as references, or you may want to give this to your physician if you wanted to discuss what are my options regarding my depressive symptoms that I'm having as I'm going through this menopausal transition. It's been a pleasure to see you all today. Have a wonderful afternoon.